This video is a discussion of our class on clinical session on musculoskeletal system. The task was to examine a 15-year-old child coming in with a leg pain to do a musculoskeletal assessment. Let's see how the candidate performs. Carry on. Start.
Okay, I will enter the room. I will hand over my examination, the sheet to the examiner, and I will take the sanitizer and clean my hands. Approach the patient and introduce myself. Hello, my name is Dr. Safia, and I'll
Hi.
be examining you today, Sarah, specifically your legs, if that's okay with you. And of course, whichever parent is present, I will say if that's okay, mom or dad. But first of all, before I begin, I'll check if you've brought anything with you today. So if I can see any mobility aids or any wheelchair or any other orthotics. And then
So there's nothing she's coming with. Yeah.
So then I'll ask Sarah. Sarah, I would like you to well I'm gonna ask if she's wearing any small shorts underneath her pants, and if she is, then I'll ask to expose her legs.
Yeah. So you are able to see her legs.
Right.
Second. Yeah. So this is what you are able to see.
Okay. Okay. So then I will before we begin, I would first of all like to ask her 2 or 3 questions. And my first question would be, so Sarah, do you feel any pain in any of your muscles or any joints or in your back or any place? And I would also ask her whether she has any problems going up and down the stairs. I would also ask her whether she has any problems in dressing, for example, putting on her pants or and her shoes or socks.
She reports that she has got mild pain in her right knee, which is usual for her, and there has been no recent change in that pain severity, and she's got no difficulty in dressing, undressing, or walking up and down the stairs.
Okay. After that, I will then look at Sarah and I will observe her for any deformity, any swellings, and I can see there is a swelling in her right knee. I will also look for any redness, any color changes, or any rashes. I will look for any asymmetry, any leg length discrepancy. I will also check her for scars. I will look from front, behind, and the back. And then once I've observed her, I will then ask her. I will tell her that I'm going to demonstrate a few moves and for to copy me. And so I first ask her to move. I'll move, walk forwards and backwards in the room, and I'll show it to her. So I'll ask her to follow me. Then I'll ask her to walk on her tiptoes, and then forwards and backwards, and then I'll ask her to walk on her heels and check if she has any pain or any difficulty observing these movements.
So she's able to walk properly, but when she struggles to walk on her tiptoes, and she reports mild, increase in her pain when she starts to attempt to walk on her tiptoes. With regards to her limb length discrepancy, there is mild discrepancy in her lower limb, but there's no limp in her gait, and there is no a painful gait or antalgic gait that you can observe.
Gait or there's antalgic gait, right? Then after she's done that, I will ask her to squat. And then try to get up from the squatting position to check for any proximal weakness. I will also ask her I'll ask for permission to expose her back and then ask her to bend over so I can check her back. I will check for any tenderness or any scars or any other deformities, any other bruises or discolorations.
So there's no bruises or discoloration or rash, and she is able to get up from squat without any difficulty.
Is there any scoliosis?
There's no scoliosis.
Right. Okay. So after that, I will ask her to lay on the couch, which is available, and I will and I will tell her that I'm going to now examine you, Sarah. But if there is any pain at any point, you have to tell me, and you've got to stop me. And I'll also, while I'm doing any maneuvers, I'll look at her eyes to check if she's got any.
Yeah. Okay.
All, first of all, I will observe her. As during examination, I'd seen that the left knee looked swollen. So during the examination, I will do check for the crepitus and any effusion.
So you can appreciate some crepitus when you try to flex and extend the knee. You can appreciate some crepitus in the right knee.
And I will check for how much restriction in her movement is, but I won't touch it. I will ask her to do it herself.
Yeah. So there is mild restriction in the flexion in the right knee.
Right, there's flexion. Then I will compare both knees by looking at the temperature.
Yeah. So there's no raised temperature or tenderness in the knee.
Is there any other bruising up above it, like above?
No, there's no rash or bruising. The skin appearance is normal.
I'm going to ask her, like, there's flexion extension. Can she? Then I'll do the. Then I will check for the hips. I will flex the hips and then check for internal external rotation.
Right. So yeah, when you do that, she's able to tolerate that well, and there's no restriction in the external or internal rotation. The time is up now. So as you could see, the candidate did a really good job in performing a structured examination of the lower limb of musculoskeletal system, and did manage to gather a lot of points, a lot of positive clinical signs that can be helpful in formulating management plan and moving forward. However, there were minor points which were missed, which was addressed in the later part of our discussion, and we also went through the areas of discussion with the examiner that can go about in this particular station, and also what to include in your closing remarks and summarizing for this examination. Yeah.
So I'll say this is Sarah. She's a 15 years old girl, and she looks on it. She looks well. She looks well. She's not in any distress, and she also looks well grown for her age. But I would like to plot her on her centile charts. On examination, I could see that there was an obvious swelling of her right knee. And during her examination of her gait, I could see I could see that there was an issue with her tiptoe walking, but heel walking was fine. There was no spine, no evidence of scoliosis, no other deformity. On deeper examination of her legs, I noticed that there was a fusion present in the right knee. And there was also restriction of movement in the right knee as compared to her left. There was no issue. There's no abnormality of there. I would have liked to further use the look, feel, and move approach for the knee by feeling for any tenderness and any other issue. Otherwise, there was no temperature.
Look at the chin. Guys, look at the chin. Ubaid, what do you think? What do you see in the chin, Dr. Ubaid?
Hirsutism.
Yes.
Yeah, that's right.
So Safiya, what this could be?
Hair, hirsutism, and swelling.
SLE-induced or juvenile idiopathic arthritis.
But why would we have hair?
It's a steroid toxicity.
So you said you would be involving the other specialities, which is the physiotherapy, occupational therapy. So what are the medical management for this condition?
Well, if there's pain, then I would.
As you can see here, there was a pallor which, if you had asked me, or if you had inspected the eyes or the conjunctiva, I could have mentioned there's a pallor. There was hirsutism, which I think in the actual exam, just if you're mindful, you would be picking that up. And then there were a local limb signs which you picked up everything, crepitations, effusions, and then comes your treatment, how would you manage this case? So obviously the child will need pain relief, chronic pain relief, which is, I mean, you will start in a stepwise manner. You go from NSAIDs, then steroids, and you would do, and then the actual what you mentioned, the DMARDs, which is the disease modifying agents, and there you have the first line agent is the methotrexate, and then the other ones are monoclonal antibodies, like in this one you have adalimumab, tocilizumab, and then you have etanercept, but most commonly an infliximab, as you mentioned. So, I mean, even if you mention 2, 3, that's fine. You'll be getting good marks there.
Yeah.
Don't.
All
Yeah,
right.
and so when you are doing the examination again, in this one, you will be looking at the hands, you will be looking at the face, and the face in the hands. So this is just a wider part of the discussion. If you see the signs in the nails, as you said, the pitting or the yellowish of the nails, which is more pointing towards the psoriatic arthritis.
Exactly, absolutely.
And then if you see swollen metacarpal metatarsal joints, then that points towards your oligoarticular arthritis.
Yeah, can be yeah, but
Yeah, and if you
polyarthritis.
yeah, polyarthritis. If you see a malar rash on the face, I mean, we all know all these things, but we tend to miss in our actual examination. For example, the moment you see this joint, you will tend to miss the signs that could be in the hand. You will tend to miss the signs that could be in the face. You will tend to miss the other small and the peripheral signs. So don't get biased just by looking a very obvious thing right in front of you when you have identified and spot on, you have got the diagnosis. Still don't be biased towards that particular diagnosis which you have got in your mind. Okay.
As you could see from the highlights of the discussion that it was quite an extensive one, and it's also a vast topic to prepare in itself, and the candidates did a fairly good job in participating in this discussion. And this area also seems to be a gray area for a lot of candidates appearing for the MRCPCH clinical exams. So how would you approach? And if you've got any questions or thoughts, please comment below. And if you would like to participate in these discussions, please leave us a message, send us a message on Facebook, or contact us on our WhatsApp and Telegram groups, and we'll hope to see you on the other side.